You're watching TVC Breakfast. The Nigerian government has renewed its commitment on the revitalization of 10,000 primary healthcare centers.
Kemi Balogun reports that globally millions of people still lack access to healthcare in Nigeria, and it's no different.
The World Health Organization believes that bringing out issues that affect global health will lead to an improvement and boost in economies around the world. But millions of people still do not have access to basic health care. Although progress is being made in countries in some regions of the World Health Organization's #1 goal is universal health coverage. What matters to the World Health Organization Nigerian team at this work to commemorate World Health Day is that there is health for all.
Commemoration or World Health Day shines a spotlight on the advantages of universal health coverage can bring to all people and in all places, and also why it is needed so much. It is needed because it ensures that everyone, no matter who they are, no matter where they live, no matter where they need it, can access essential quality health services without facing financial hardship.
Only recently, President Muhammadu Buhari declared his worry over the increasing rate of medical tourism by Nigerians, which contributes to the country's loss of 400 billion naira on an annual basis. The president said that his administration is targeting 10,000 functional primary healthcare centers. For the Nigerian government, it is all about support and collaboration to get to the universal health coverage target.
We face a near collapse of the health system. The primary system collapsed. Everybody will walk into National Hospital to UCH, to Lutz and ABU teaching hospital for headache, fever and diarrhea. And that shouldn't be so. And so what we've done is let us make sure we reorganize the healthcare system. Put more emphasis on primary care to handle common things. Fever, pregnancy, all the related things, vaccine, family planning, can be done at primary care center. And we are putting emphasis on this.
The World Health Organization believes that countries which invest in universal health care will make a sound investment in their human capital.
Balance of major public health events, there are way over 100 in 2018, means that there can be no health security without universal health coverage, and no universal health coverage without health security.
Globally, the World Health Organization is committed to getting 1 billion more people to benefit from quality healthcare services and financial security by the year 2023. Kemi Balogun, TVC News, Abuja.
Well, joining me from Abuja is a former president of the Nigerian Medical Association, Professor Titus Ibekwe. Thank you for joining us on TVC Breakfast. Now, despite the introduction of the National Health Insurance Scheme for many Nigerians to have access to quality health care, many Nigerians still do not have that access. So what are we not doing right?
Universal health care is very much desired by all, especially for Nigerians. It is the way to go. But the reality on ground is this achievable with the current situation on ground, and giving every holistic assessment of our healthcare system, putting into perspective the issue of health insurance scheme and our healthcare financing, then the state of our primary health care, which are like the tripod upon which achieving this desired goal lies on. That is the area that is worrisome, because given that the National Health Insurance Scheme has been on now in Nigeria for the past 14 years, and we can only boast of 5% coverage. If we continue, if the growth continues at this pace, it means that it takes minimum of 280 years for us to be able to cover the entire country.
So are you saying that the target, the 2030 target, will be difficult to achieve because the government has just said that it is targeting 10,000 functional primary healthcare centers to help us achieve that target?
Yeah, The point I'm making is that we need to step up our games if we have to achieve universal health care coverage in 2030, which is the benchmark that World Health Organization and United Nations has set for us. It is desirable the way the government is going to try to rehabilitate most of our primary health care. Recall I said that the primary health care is one of the tripods upon which achieving this desired healthcare system lies on. So that is one way, trying to make sure that the existing primary healthcare centers are well equipped. They have essential drugs. They have enough human resource that will be able to attend to the sick within the nooks and crannies of the country, especially the hinterland. But beyond this, you know, for a system to be sustainable, there must be a driving force. That was why I was pointing out the other two arms upon which this rests. That we have to look critically into turning around our insurance healthcare system, because there is no healthcare system that survives on out-of-pocket expenses. So for this to work, even after the revamping and rehabilitation and making functional 10,000 primary healthcare outlets in the country, then there must be a sustainable financial system to be able to drive this.
All right.
And that's where the
former Vice President of the Nigeria Medical Association, Professor Titus Ibekwe, thank you for your time on TVC Breakfast.